my name is Clinton Jones. I'll be 77 years young on May 24th. I was drafted by the Vikings in 1967, the second pick in the first round. My teammate Bubba Smith was the first pick in the 1967 draft. I was the second pick, and my other teammate from Michigan State University, George Webster, was the fifth pick, and Gene Washington, who came with me that same year, he was the eighth pick. So in the 1967 draft, four of us were from Michigan State, number 1, 2, 5, and 8. And so we played, Gene and I played against Alan Page, who was another first rounder in the 67 draft. He played at Notre Dame in the game of the century, which was November 19th, 1966. We're the formation of the new era that came to be known as the Purple People Eaters in 1967. And that's when football was football. WUZ was football. And so I had a wonderful career with Minnesota. I played for 6 years, and actually I wanted to make my home in Minnesota and live in California in the wintertime. But I wound up being traded in 1973 to the San Diego Chargers. So my career, I played 7 seasons. My last year, set out the injured reserve, retired in 1975, July 1975, and then I entered chiropractic schools September 8th, 1975. And so how did I come about ARP? Well, I've always used, I'm an adjuster. I believe in adjusting the spine. The one thing that I learned very early, because at my school, Cleveland Chiropractic School, it was emphasized the central nervous system, which is the switchboard to life. And you have to be neurologically tuned in, otherwise things don't work properly. And so I first got introduced to ARP by accident. So I was fooling around on the internet looking for someplace I could get stem cell therapy. And I came across a link in Paris. And somehow that linked me to ARPwave and a lady in New Jersey named Debbie Gray. And so I got in touch with her, was able to and she sent me an ARP to use in some patients. And at that time, I was working with some Olympic athletes. I forget what Olympics that is right now. But I was working with a young lady that actually ran recently, who was a mother and ran the 400 meters. I think maybe not this Olympics, the last Olympics. She got the silver medalist. She's one of my patients. And I had a sprinter and a world-class hurdler, and working with them, man, it really changed my life, actually, because after a while, just adjusting patients is not enough. But what I want is results, and to really get in there and see some dramatic results. And I started using it on myself, and I realized the amazing things that I could do with ARP. And I had some really what I would call massive results in terms of how fast you could heal the body, and also how efficient it would become. But I'm very excited about this technology. Very excited. It actually changed my whole perspective, because I had something that nobody else had, and it just it did wonders for myself and my patients. And so in 2000, I had my knee's been bad ever since I was 47 years old. I forget what year that was, but I was really had a bad back, bad knees, and was disabled. And I was declared actually all these injuries came from football. But I didn't want to get any knee replacement. But I finally got a total knee replacement May 10th, 2012. We go see my doctor. He said, you just accelerated your healing by 2 weeks. I had 4 range of motion, guys. 4 range of motion. And the thing is, when you have that full surgery like that, they have a PT come to your house for 2 weeks. And then you go to outpatient for 2 weeks and have a nurse come in. Nobody ever came to my house. One time the nurse did. Came to my house. I never saw her again, never had any PT. So in the first surgery, ARP was the only thing that I used. The only thing. And man, I was up and walking around within 3 weeks. Well, fortunately, the right knee wasn't as bad as the left knee. The left knee had the bone had deteriorated so much that it went from being straight like this to being bowed out like that. I had actually a lot of structural damage, but in the left knee. But with the right knee, I would only be in pain if I was standing or walking. Now, what's interesting? Now, this is the first time that I've ever had PT. And I'm going to tell you this: there's a big difference between PT, physical therapy, and the art. I don't remember being sore, but I mean it's been 10 years because in PT, but I knew they use sandbags to try and different things to try to get your extension. Um, but already within 2 weeks, I had full range of motion. You know, at flexion is full range. An extension, I was about 10, maybe 10 degrees off. So they had a physical therapist come by. He said, you need to get that extension. And that day, he did some exercise and I put a sandbag on. I shouldn't have done that because it made me kind of sore. But with the ARP, I'm back at zero. I'm at zero. You can't see it. Extension. I can actually lay the popliteal flat against the floor. Now my surgery was January 31st. That's pretty damn quick.
I think
And I was driving 2 weeks after the surgery. Got operated on January 31st, 2 weeks, and my wife wasn't too pleased, but I know my body, so I drove to the grocery store, but I had no problem at all. So nothing's more eloquent than actual proof. So I'm actual proof of the benefits of art. It changed my whole life. When you can't run, when I go to the airport, I have to get a wheelchair, but I can't walk the distance that it takes to go from the check-in, to the departure place. I took my granddaughter to her track practice. She's 6 years old. Yesterday, and I was able to walk around. I didn't have to sit in the stands, just lay down on the grass. I was able to walk around. So the interesting thing now, I have, which is natural, like some stiffness, but I'm in no pain. But it's like muscle stiffness from exercising, which is what you're supposed to have, lactic acid. That's why I did have a buildup of lactic acid from working out that particular day. But it's just, you don't know what a thing can do until you use it. And I've been talking to my friends, my generation, about this technology. When you talk to people, most people, they think it's like a TENS unit or interferential of all these other types of electromuscular stimulation, but they have no idea because it's always been, the philosophy in chiropractic. If you're going to cure illness, you have to know the cause. And this is very, very important. And I know this from my 42 years of being a chiropractor. We look for the cause. So we look for the cause in the central nervous system. And any injury, that's never where it starts. It's always someplace else, because someplace else has a dysfunction going on. When you find the cause, you can correct the condition. And that's what I love about the art. It's just not palliative. You really get where you get functional. And as we get older, one of the things that we start losing is our blood isn't strong, our central nervous system is strong. But when you can tune in, you can dial in, and that cause, then you get a different effect in the body, become more functional. So that's how the art, is head and shoulders above anything else that I'm aware of.